I see your name here and your address. Can you just confirm your date of birth? Okay, beautiful. And are you allergic to anything? What about latex gloves? Do you have any? No? Okay, good. Would you like to add on the allergy test today just to make sure? Yeah, so it's really easy actually. We just swipe some allergens on your arm, so not your face or anything, and it's very little concentrations of it, so it'll just slightly turn red if you're allergic to it. Yeah, okay. Let's do that. And do you have any trouble seeing? You wear contacts or glasses? Okay. And any concerns with your skin? Okay. Bit of sensitivity. Any specific spot? Your skin overall, okay. And what about your scalp? Is the okay. Alright, we'll get that checked out. What's your current skincare routine like? Okay, and you do that every day? Okay. And what shampoo do you use? Alright, perfect. Just alright. So just the allergy test. Which eye? And do you have any trouble hearing? Okay. We like to whisper throughout this just to kind of gauge how your ears are. It's a really interesting clinic actually. People find it very relaxing. Sometimes they want to fall asleep to it. Yeah. But we like to whisper to keep it quiet and hear how you respond to the whispering. If you say what a lot, it's kind of like an ear exam all throughout. Yeah, but on that note, since people find it relaxing, would you like some calming gummies? Yeah, here you go. Just a mix berries and cream. They're delicious. I give them to all my patients. Yeah, they just have ashwagandha, L-theanine, magnesium, and lemon balm. It's gonna help you relax a little more. Yeah, stress is the #1 cause of disease, and with the ashwagandha over time, it's gonna help with stress. Yeah, it's an adaptogen, so alright. So let's see, we'll start with your vitals. relax your arm and just hold it straight. And then it should tell me your heart rate and your oxygen. Oh, it's already done. Okay, perfect. The normal resting range, 97 oxygen level. Good. 50 beats per minute. Okay. And I'm gonna get your temperature. So I just need you to stick your tongue out and just lift it up. Okay. Perfect. 98.7. Good. Alright, so no cold symptoms or flu-like symptoms. Okay. Okay, and now I'm just gonna put some gloves on so we can look really close. Okay. Let's actually put this keyboard away. I need that anymore. And how are you feeling overall? Do you have any physical concerns? Okay. Yeah. But headaches. Alright. Yeah. That's do you notice at any time when you get the headaches? Okay. Alright. Perfect. I'll keep that in mind when I'm taking a look inside of your eyes. And do you go on your phone a lot with like full brightness or anything? Because I sometimes notice like with technology, they can cause headaches that stem from the eyes, and that's kind of like you said, stemming from right there. That's what it could be, but then again, we'll have a look. Of course. Just keep this closed. Alright, so I'm going to start with just looking inside your mouth. So, do you mind just sticking out your tongue to look? Perfect. I don't notice any redness. Do you mind if I feel your lymph nodes? Okay. Just little bit, little inflamed, nothing crazy. Do you hold any neck tension or posture tension? Just relax your shoulders. Stress. Yeah. What do you do for work? Okay. Yeah, that definitely sounds a little stressful, but that's really cool. Yeah. You are definitely making such a difference. You must be really busy all the time. Yeah. Okay. But, nothing crazy, just, throughout the day, check in with your posture and just try to relax. And, if you're on the computer a lot, just really try to bring your chin in and drop your shoulders. Yeah, good. Okay. And do you mind puffing out your cheeks for me? Okay, perfect. And just lift your eyebrows. you mind looking up for me? I'm just gonna pull down your lower eyelid real quick and just have a look at your waterline. Just look up. Yeah, you can blink. Good, and once again, just look up. Okay. Have you ever had any styes on your waterline? Okay. And just look to your right. Let's see. Alright, and blink. And look to your left. Okay, good. Yeah, you can blink. Okay, and I am just going to quickly do a peripheral vision test. So just look at me and tell me when you see the light in your vision. Okay, just look at me. Good. Good. Great. Alright, now do you mind following the light? I'll tilt it down so it won't be as bright. Just follow it. Okay, good. So your eye movement is spot on. Alright, amazing. We'll come back to that in a moment, but I'm just gonna have a deeper look inside of your eyes. So, this will be a little bright. I'm gonna shine it in your eye and just have a look. Okay, I think that's steady, so just look right here for me. Perfect. Good. So let's turn this off. Okay, good. So, I'm gonna first examine your face, but I have these cleansing wipes. They're just eyelid and eyelash cleansing wipes. Not that your eyelids or eyelashes are dirty or anything. I just like to recommend these to all my patients, because sometimes when we're washing our face, we're not really, getting deep into the eye, because soap and everything, everyone avoids the eyes. Even if you go over, these are just perfect for cleaning the eyelashes so that they can stay clean for the eye to flush out any debris or anything like that, or preventative of styes and everything. So, do you mind if I do this? Clean your eyes. Okay, we'll do it in a moment, but I'm gonna examine your face first. So, you can keep your eyes shut for this, because I'll be having a look at your eyelids as well, and I'll be shining a bright light in your face, so I'd recommend closing your eyes, and I'll just Have you always had this mole right here? Is it tiny? Okay. Yeah, I'm not seeing any raised anything, so. Keep your eyes closed. I'm just gonna gently look over your eyelids. Okay. Look at your hairline a little bit. Okay. This out the way. Let's see. Gently touch your face. Okay, and I'm gonna get some measurements just to see if the proportions are even, although I'm not noticing any raised bumps or unevenness, and I had you move your facial features, so no numbness or tingling. Okay. See that? Okay, good. I'll just write something down if it's not just in case it turns red. Alright, are you ready? Okay, which arm would you like? This one? Okay, let me see the board. So let me just make some markings. We're going to do 6 common allergies. Okay. Stop that. This one. Alright. Perfect. And let's do this first. And I'm gonna put it just a little bit. Let's see. Okay, good. Allergy number 1. So I'll just kind of wait it out and see if your arm turns red. If you notice any pain or burning, just let me know, but it's so little, I don't think you would. We're just looking for, of course, the redness. So, okay, good. Use this other side. Just put this one. Okay. Actually, make one more marking because I forgot the one allergen. Okay. Great. Stick this. Okay. Dip that. Perfect. Let's use this other side and dip into this allergy. Okay. Perfect. And one more. Okay, and you feeling, is your arm feeling okay? Good. I don't see any redness so far, so that is a good sign. Alright, so we'll just give that one moment. See, do my alcohol spray right here. Yeah, no redness. You're correct, you do not have any allergies. Let me just put this allergy away. Allergen, and let me take this one. Alright. So I'm just gonna spray your arm and just wipe that off. It's just an alcohol spray. Just okay. And we'll gently okay, perfect. I'm just trying to tap that. Perfect. Okay, well, you do not have any allergies. I'm just gonna write that down real quick. Just for next time when you get a medical exam, to make sure that that's confirmed so that they can see it in your charts. Okay, perfect. stress over time if you take them consistently every day. So we'll have you get some of those if you want, of course. I'm just going to recommend them in the chart and add them to your supplement list. Okay. So, like I said, you can get those on Amazon. Sadly, this hospital, we can't send you home with them or, send them to your house or anything, but you can get them on Amazon. Yeah. Alright. And your eyes are good, your scalp, your hair looks really healthy. Yeah. Just a little dryness, and then your face is, facial sensations are working. Okay. Perfect. And then I just recommend a full eye exam if you want, just to get it checked up and see if there's any changes. Of course. Alright, well, my name is Dr. Ely, by the way. Nice to meet you. It was such a pleasure. You're very healthy, and I hope you have a wonderful rest of your night, and I hope to see you